All right, wonderful. So, thank you everyone for coming in and joining us today for the second member orientation and networking session. We're going to give another minute or so to let folks get logged in and get situated. But in the meantime, again, just thank you so much. It's wonderful to have everyone here today, and we hope that this is going to help you make the most of your Endocrine Society membership. We'll give another minute or so. Looks like we have a couple folks trying to get logged in. Um, but for now, I will hand the reins on over to a special guest for some warm welcoming remarks. Allow me to introduce the president-elect of the Endocrine Society, Dr. John Newell Price. Dr. Newell Price, take it away.
I guess it's good morning to many of you. It's good afternoon from me here in the UK. So this is a really warm welcome to the Endocrine Society. It's great that you've chosen to become members. I was looking at the list of people who have signed up for this, and they are varied in their geographical location because the Endocrine Society is an international society. There's around about 35 to 40% of members are non-US. Around about 18,000 members. So you're joining a big family. And really, the Endocrine Society's mission is quite straightforward. We aim to really push the boundaries of the science and clinical practice of endocrinology and lead that across the world, essentially to improve human health. And as you know, there are a whole variety of different activities that the Endocrine Society has. And these are activities, hopefully, you'll be keen to get involved with. And you will have a variety of different reasons why you've sought to join. You gave some of those reasons. Some of those reasons is access to journals. Some of those reasons are being able to get education and meetings. And of course, the big meeting, the Endo meeting each year, is a fabulous time to get involved with networking and learn the science and clinical practice, but to meet your peers. And today, of course, you're going to meet some of your peers who are on this membership orientation. And there are a variety of other activities that the society has. So, for example, there's Doc Matters, particularly for those people more clinically orientated. Lots and lots of different education programs and lots of opportunities. So there's special interest groups and there's opportunities for volunteering in those, and opportunities as well for volunteering on other committees and other activities. And I think it's really worth going to the website and looking across the breadth of what the society of which you're now a member really gets up to, because I think it's quite easy to think it's journals and endo meeting, but actually it's a lot more than that. And I guess just to make this a bit more personal, I'll just give a sort of slight history of how I became involved. So I gave my first presentation at Endo in 1995 as a junior fellow, which was an absolutely terrifying thing to do at the time. In those days, it was relatively combative in terms of the questioning that one may get, but it was fine. And in fact, I had a whole load of rather senior members of the Endocrine Society come up to me afterwards, wanted to hear about the science, wanted to interact, and that was just so encouraging. And this was at a meeting with thousands and thousands of people, and I just felt it was an amazing opportunity, and I've been coming to the meeting ever since that time. And in addition, I've been involved with the clinical practice guidelines, working on quite a number of the different committees, and seeking to really do everything I can to actually be involved and push forward the mission in its broadest sense. And I think it's worth noting that I absolutely would not be standing here, and I would not be standing in my current post as a professor of endocrinology over in the UK had it not been for the Endocrine Society, because I have managed to meet and network with so many people that has really made a huge difference to my career in research, my career in clinical practice. So I'm an adult endocrinologist, but I have a decent sized research group, and it's made a massive difference. So I think that my advice is to really get involved, understand that you're part of a big family. You can find a particular area within the Endocrine Society that will be a fit for you, embrace it, look at the journals, publish in the journals. You're going to hear lots about the journals during this orientation. They're a fantastic opportunity to get your science out into the public domain, and all the other activities you're going to hear about again on this networking orientation. And then I would encourage you to use this opportunity, to use the opportunity of the meetings, particularly Endo, because it's the biggest meeting, to meet with your peers, to talk to your peers, and to really involve yourself in this large, big family that will not only allow you to contribute, but will actually greatly enhance all of your careers. So this is me signing off with a very, very warm welcome.
Wonderful. Thank you so much for that, Dr. Newell Price. Those are absolutely good points, and so many of those things that they'll be touching on today that really will empower every one of you and every one of our members to make the most of the membership they have here and the resources society has to offer. And thank you again so much for joining us today. Moving on, I wanted to quickly touch base on what we'll be talking about today. The Endocrine Society has a lot of resources. We could spend a whole 4-hour symposium and still not hit everything. But we wanted to focus on what you're interested in learning about. So this presentation is going to have high-level overviews of the Society's interests, just enough to pique your interest and hopefully prompt some questions. So please, if any questions do come to mind, don't be shy about putting them in chat. We do have a Q&A and discussion section after each section here, so we'll be able to get those questions answered. This presentation will be available for download after today, and all the links you'll see in the slide deck are live, so you'll be able to click on them and be directed to more resources on our website. Without further ado, I'm going to hand the first part of this over to my colleague, Alan Stalp, who's going to go over some of the resources and how to access them.
Awesome. Thanks, Ben. Hi, everyone. I'm Alan, and I work in our member services department. And I'll be going over the basics of managing your account and navigating our various websites. So you'll see here, here's how you can contact our member services team. We're available 8:30 a.m. to 5 Eastern Standard Time via email, telephone, fax if you need to fax any payments. And we also have a chatbot feature on our website. It's at the bottom right. You can use that to get to some of our things that are current. And then if we are not available, or if you don't find what you want, then you're able to submit a ticket. And that would be outside of these live chat hours. So if you can't find anything on the chat bot, it comes to us. And if we're outside of those hours, you can leave a ticket. Let me know in the chat if anyone has ever tried to leave a ticket for us and how your experience was. All right, so let's take you to the beginnings of logging in to your Endocrine Society account.
Alan, you're muted.
Oops, sorry about that, guys. So let's take you to the basics of logging into your account. So at endocrine.org, you'll log in at the top right. And then to manage your account, you'll select your account and tools at the top right there. And then at the bottom left of that box that appears, manage your account. So this is where you can do a variety of updates. You'll see your member ID in the top middle there. You can update your primary information, such as your title, your company, and address. And now I'll go over a couple of items under the My Account links. To the right there, there's your personal and professional profile, which has your general interests, research interests, and practice areas that you can update. That's also where you can update your Find an Endocrinologist profile. If you're accepting patients, you'll appear in our physician directory there. We have speaker profiles that you can update for yourself. Your membership is where you can sign up for auto renewal. That saves the hassle of having to renew manually every year. That's in September. And you can update your auto renewal information there if you are already added to auto renewal. Invoices is where you can find your receipts. Transaction history is for your membership certificate. View previous transactions for products, services, or events, and access ebooks. If you have any ebooks, it'll be in your transaction history. We have a Get Involved form that you can apply for. We have program applications. That's the section where you'll see any open award opportunities. So be sure to pop into there. It'll take you directly to the award where you can apply for it. It'll show you the specifics of what the award is and the eligibility. You can change your password there as well. We have the communication preferences, the fourth one to the bottom there. It's where you can manage your emails that you receive from us. Sign up for special interest groups. And then don't forget to add your photo at the top left there. All right, let me take you back to our homepage. You'll see there's an important area at the top where it says Our Other Sites. And that's an area where you can click down there and it takes you to the links to our important other sites, such as our Center for Learning, which is the primary CME hub. Endo Careers is our job board where you can search for jobs or post jobs. Endo Sessions is for session recordings prior to 2022. Newer session recordings will be in our Center for Learning. Society Journals will take you to our Oxford University Press Journals website. Endocrine News Magazine, Content Licensing Information Link, and the PATH program. So let's select that first one, the Center for Learning. So the Center for Learning is the primary hub for all your CME needs. First, be sure that it says your name in the top right, and then that's how you know you're logged in. And this website is built to the preferences that are set up in your account. So as I alluded to earlier, be sure to have a complete profile, and so that this website can be exactly tailored to what you're interested in. While searching the Center for Learning, be sure to take advantage of the filters across the top menu or search by keyword. We offer filters by topic area, target audience, and credit type there. And speaking of credit type, like I stated earlier, we've made it easier for you to ensure that you, as the user, see programs that are fit for your preferences so you don't miss out on unclaimed CME and MOC when you're up for renewal. On the left-hand side there, you'll see my profile. Sorry about that. At the top left-hand there, you'll see my courses. That is where if you purchase any courses, they'll be available there for you to complete the courses. And once you complete the courses, the transcript is where you'll be able to go to confirm that your CME has been submitted, and you can print out your CME certificate, and MOC gets transmitted online automatically there. Put in the chat if you've ever taken a course in our Center for Learning. If so, which one did you find most interesting? All right, and the Center for Learning is also available as an app, so don't forget to download that and take your CME on the go. All right, so let's take you back to our homepage there. You'll see the thumbnails below our other sites, such as news, endocrine topics, awards, practice guidelines, and our online store. Our store is where you can purchase some of our flagship items there. We have our ESAP and pediatric ESAP, which contain clinical questions, individual performance reports when completing them, and 3 learning modes to complement your style of learning. ESAP is updated annually, and pediatric ESAP every other year. We have our EBR books, which are used in our yearly endocrine board review, which contains ABIM's style prep questions. We have our Meet the Professor, which is released in conjunction with our Endo annual meeting. Contains a wide range of clinical topics, session recordings where you can view anything that you missed. And then we have fun stuff for our merchandise, such as pins, plushies, keychains, shirts, and a whole bunch of swag there. All right, I'll do a brief introduction of our journals since my colleagues will take you into a deep dive. We have 5 scientific journals, the JCEM, which is the most cited clinical research journal in endocrinology and metabolism, Endocrinology, the leader in hormone science and research, Endocrine Reviews, authoritative review articles on clinical and research topics, the Journal of the Endocrine Society, which is an open access journal, which contains clinical research, clinical practice, and basic research, and the JCEM case reports, another open access clinical cases from across endocrinology. Our journal site can be located at the top. You can get there by going to the Our Other Sites section, and then you can select journals. So when arriving at the journal's website, you'll see it here. This is the Oxford University Press website. Top right, you're going to want to select that person icon, and then you'll see sign in through society site. So that will give you your member access. Note that if you select that sign in below that, that would be your Oxford University specific website sign in. So be sure to select sign in through society site to get that member access. All right, so we offer a variety communications and events for you all. We have our e-newsletter, which is a weekly virtual newsletter. It tells you everything you need to know about what's happening in the field of endocrinology. Our Endocrine Feedback Loop podcast series. Each episode will feature an expert educator and topical specialist dissecting recently published journal articles and discussing implications for clinical practice. Our endocrine briefing is delivered weekly at 2 p.m. Eastern time, and the subject line will begin with endocrine briefing, so you can easily spot it in your inbox. Endocrine News, it's the only feature magazine that covers the field of endocrinology, as well as the professionals within the field who are making a difference in advancing human health worldwide. And our Endocrine News podcast, the Endocrine News podcast brings you the latest research and clinical advances from experts in the field. Whether you are in your car, office, or out for a run, you can listen to that podcast. And we have our events here. We have our flagship Endo event that's coming up in Boston, beginning of June. Our board review is a preparatory course for initial or recertification, and our virtual clinical endocrinology update. So don't forget to mark your calendars for this year's events. And speaking of mark your calendars, at the top of our website, you'll see in that thumbnail section, we have the meetings and events. And we created a society calendar, which lists everything that we have to offer from our main meetings, professional development, educational webinars, advocacy events, and a lot more. So that was a little bit of our various websites and navigating them and the logistics to get into them. So thank you.
Awesome. Thank you so much, Alan. Those are some great resources, and thanks for showing us how to get to them. Now, also, speaking of the Endocrine Society calendar, this is such a valuable tool for keeping track of what's going on in endocrinology, what programs, activities, opportunities the society has to offer and when they're happening. Also, even beyond, we have events from all around the endocrinology world. So I'm going to pause for a moment here to give everyone the opportunity to go to the Endocrine Society website, click on that meetings and events page, scroll to the bottom and click on that calendar and bookmark that calendar, because that is going to be an incredible resource for you to keep track of everything going on. I'll give everyone 15 seconds. I'm going to pause real quick. Don't worry, we'll be here. Go ahead, do that in the browser of your choice, Chrome, Firefox, what have you. And once we get back, I'll carry on with a few other valuable resources. But again, I strongly encourage bookmarking this calendar. It is going to be an incredible tool for helping keep track of everything the society has to offer and when those opportunities are going to be happening. All right, we good? Great. Okay, well, moving on, speaking of incredible value and resources that society has to offer, our clinical practice guidelines. These are very, very useful tools for anybody in clinical practice. They are timely, evidence-based recommendations for clinical care and practice. They're easy to access we have an app, we have physical cards you can keep in your pocket, and we're continually developing new guidelines and updating existing guidelines as clinical science evolves and to keep up with the needs of our physician community. You can see here some of the CPGs that we have currently available and some that are in development. You can also take a look at how they're being developed and then get a link to the app here. Again, this slide deck will be available afterwards, and all these links will be available to click on afterwards. Speaking of our community as a whole, not just our physician community, but our entire membership community, researchers, scientists, everybody who is touching the endocrinology field in our membership. Endo Forum is our online community, the Endocrine Society's online community. This is an incredible resource for connecting across the world, connecting with colleagues, sharing information, sharing ideas, collaborating, getting questions answered. It is a moderated online community, so you know that the responses that you're going to be getting are going to be the highest quality, but also it allows you to connect with people who share your topic interest areas or finding mentors or colleagues to work with. Now, we also just launched a really cool series called the Endocrine Case Talks series, where there are virtual discussions that are based on the hottest discussions in Endo Forum. So we have the authors and some of the commenters on these posts talk about them in a live discussion format on a webinar and a Zoom meeting, and have audience interaction to be able to participate in the discussion as well. We hold these quarterly, and we're going to have a couple of live versions of those at Endo this year, so I highly recommend checking that out too. So to get to Endo Forum, to get the online community, Real easy to do on our website. Just click on the Our Community navigation tool at the top there, go down to the Endoforum community and click on the link. And everybody who is a member of the Endocrine Society automatically has their access set up when they join. And then our friends at Doc Matter who moderate the community are fantastic at helping folks get set up, get their preferences perfect so that all the content in the Endoforum community is tailored to what you want to see. Again, speaking of communities, we have special interest groups, which are member-led, topic-focused sub-communities within the larger Endocrine Society community that are designed for helping members connect with each other on these specific topical areas and building communities and information sharing and knowledge sharing around these specific topic areas. Again, they are member-led. They provide educational programming and webinars. There's opportunities for discussion and networking between members of these special interest groups. There are also great leadership development opportunities, such as becoming a member of a SIG steering committee and helping develop these educational programs and these networking events. So great ways to get involved here. And speaking of ways to get your name out there and get recognized for doing cool things, the Endocrine Society has a lot of awards opportunities. This is just a taste of them, an example of them here. Travel grants, education grants, investigation, abstract awards, all these things are available for any member to apply for. And again, this is just a taste of them. I highly encourage you to take a look at a few more of the details behind what awards are available. Now, member resources here on the professional development front, we have these professional development communities that are tailored towards specific segments of our membership, including researchers, clinicians, traditionally underrepresented groups within the medical field and the endocrinology field specifically, folks who are just getting started in their endocrinology career. These are great ways to connect with other folks who are in the same situation as you, also to find mentoring opportunities and to get education based on where you are in your career and what you're looking to do. Now, advocacy is near and dear to my heart. I love the idea that as a part of a society, you can have an individual impact that echoes out into a larger community, into a larger field. And the way the Endocrine Society does that is we as a society are involved in advocating on clinical and research policy issues that improve the lives and work of everyone connected to endocrinology, from increasing research funding to improving access to life-saving medicine like insulin. So as I mentioned, as a member, you can help influence the future of endocrinology through participating in Hill Days, through joining online advocacy campaigns, or volunteering to work on policy positions. So these opportunities, you can see some of the campaigns that we have going on and ways to get involved here. It's a fantastic way to make an individual impact on a larger scale. And as Dr. Newell Price mentioned before, there are great ways to get involved with the society, with what it does, and how it operates as well. There are ways to get involved on through specific programs like task forces or work groups, through our committees, and all the way up to the board of directors and even the president. And also there are great micro-volunteering opportunities as well, like on this very orientation. We have a few volunteers here that we want to make sure that all the member voices are represented. So I'm going to pause here for a moment and want to check if anybody has any questions about what we've gone over so far, any thoughts or experiences that they've had with the resources that we've mentioned. I see we have quite a few folks in the audience here. Has anyone served on a committee or attended any of our education programs, or have you joined a SIG, a special interest group? Let us know in the chat, or if you have any questions about them. But in the meantime, I'd like to introduce our 4 volunteers for this orientation session. Dr. Sandra Licht and Dr. Kamel Al-Naga, who have been Endocrine Society members for a little while now, and Dr. Claudia Villatoro Santos and Dr. Haviza Naz, both of whom joined within the past few years and still have that new member glow. So thank you so much for joining us. So I guess I will toss those same questions to Dr. Licht. So could you tell us about your experiences with the Endocrine Society resources? What kind of benefits have you found most useful?
Hi to all. I am from Buenos Aires, Argentina, really far away from the States. And I joined the Endocrine Society in I think it was 1996 or 7, something like this. So I think that you can imagine it was really a huge thing to become a member of the Endocrine Society because it helped us so far away to be involved with all the topics related to endocrinology, and also to, as Dr. John said at the beginning when he spoke, it allowed us to meet other people, our peers, people that publish, people that were so kind, sharing to us all the experience and all the knowledge that they have. And of course, I was a member for a couple of committees since I joined the Endocrine Society, and it helped me a lot to know all these people, and of course to also to share with my colleagues from Argentina and also for South America all the benefits the Endocrine Society can give to us. So for me, it's a huge pleasure to become a member of the Endocrine Society.
Wonderful, thank you. I really appreciate that exploration of how the Endocrine Society is truly a global society. That we offer resources and connection to people in the endocrinology field all around the world. So thank you so much for sharing, Dr. Licht. I really appreciate that. And just for the sake of curiosity, Dr. Villatoro Santos. What kind of resources have you found most valuable as a relatively newer member? And how's your experience been so far?
So I've been a member, I think 5 years now. I started as a 2nd-year resident in internal medicine. I'm a 2nd-year fellow now, about to graduate. And the resources, I've been I've participated in some of the training programs. There was a new obesity fellows education or training series that launched this year, which was great. So I attended that. I am going to do the type 1 diabetes fellows, which has been around for a few years. So I'm very excited, look forward to that. So both of those resources are educational, and I think the training programs have the Endo Society as a support for our training needs. There's a lot of educational, like the Center for Learning that you showed. There's a lot of resources there, so I've used that quite often. And the clinical guidelines are also, what we look for whenever we have to answer a question or whenever we have to prepare a talk. We do some, I've done quite a bit of education for our residents here. I'm at the University of Michigan. So some of the talks that I've given, everything is based on the guidelines, or, use that as a backbone for that sort of thing or sort of activity. And then the networking. When I was in my right around the 2nd year, that was part of the reasoning. That was my initial link to the society, to kind of network and talk to the program directors of the fellowships. And I met quite a few. And this was when COVID was around, so my first meeting was virtual. So I talked to a lot of people over email, and I got to meet a lot of people out of other fellows, even though it was virtual, and we connected via Zoom after that. So it was really useful and very helpful to know like what programs were available, which ones were, because I could talk to the fellows like very candidly, and they were very open. So everyone, that was one of the things that I was like, yes, I'm going to be an endocrinologist. Everyone was very friendly. So that was great. Me being nothing, as you feel when you're starting, to get to meet all of this wonderful, world-renowned specialists. It was really nice. It's been really nice.
Fantastic. Thank you so much for sharing and for sharing that experience. It sounds actually very similar to what Dr. Newell Price was mentioning at the top of the orientation, where like coming into the society as someone who's relatively new to the professional aspect of the field or getting your name out there can be pretty harrowing. But entering into a welcoming community and a community where it's easy to make those connections and more comfortable to make those connections, it really does help get more comfortable with what you're doing and how to break out in the field. So again, thank you so much for sharing that, Dr. Gutierrez Santos. It was really, really helpful.